Prometric QA and rationals. Health promotion and maintenance. 1. You are caring for an infant who is just about 12 months old. Which assessment data is normal for the infant at this age? The infant had doubled their birth weight at 12 months. The infant had tripled their birth weight at 12 months. The mother reports that the infant is drinking 60 ml per kilogram of its body weight. The infant had grown a quarter inch since last month. 1. Answer A. The normal assessment data for the infant at 12 months of age is that the infant has doubled their birth weight at 12 months of age. The mother reports that the infant is drinking 60 ml per kilogram of its body weight, and the fact that the infant had grown a quarter inch since last month are not normal assessment data. Infants are fed breast milk or formula every 2 to 4 hours, with a total daily intake of 80 to 100 ml per kilogram of body weight. As the neonate grows, they gain 5 to 7 ounces during the first 6 months, and then they double their birth weight during the first year. The head circumference increases a half inch each month for 6 months, and then 0.2 of an inch until the infant is 1 year of age. Similarly, the height or length of the newborn increases an inch a month for the first 6 months, and then half an inch a month until the infant is 1 year of age. 2. You are the nursing supervisor in a long-term care facility. One of the major considerations that you apply into your practice is strict infection control prevention measures, because you are knowledgeable about the fact that the normal aging process is associated with the deterioration of the body's normal defenses. Which theory of aging supports your belief that strict infection control prevention measures are necessary? The programmed longevity theory. The immunological theory of aging. The endocrine theory. The rate of living theory. 2. Answer B. The theory of aging that supports belief that strict infection control prevention measures are necessary is the immunological theory of aging. The immunological theory of aging states that aging leads to the decline of the person's defensive immune system and the decreased ability of the antibodies to protect us against infection. The programmed longevity theory of aging states that genetic instability and changes occur, such as some genes turning on and off lead to the aging process. The endocrine theory of aging states that aging results from hormonal changes and the biological clock's ticking, and rate of living theory states that one's longevity is the result of one's rate of oxygen basal metabolism. 3. You are caring for a group of elderly clients, many of whom are affected with multiple chronic disorders and are also, at times, affected with some acute disorders that require medical and nursing attention. As you are caring for these clients, some will need a new medication regimen for an acute disorder. You should consider that fact that the elderly population is at risk for more side effects, adverse drug reactions, and toxicity and overdosages of medications because the elderly have increased creatinine clearance, impaired immune system, decreased hepatic metabolism, increased bodily fat. 3. Answer C. The elderly population is at risk for more side effects, adverse drug reactions, and toxicity and overdosages of medications because the elderly have a decrease in terms of their hepatic metabolism secondary to the hepatic functioning changes of the elderly secondary to a decreased hepatic blood flow and functioning. 4. What is the expected date of delivery for a pregnant client when her last menstrual period was on October 20, 2020? July 27, 2021. August 7, 2021. June 7, 2021. August 1, 2021. 4. Answer A. The expected date of delivery is calculated using Nagel's rule, which is the first day of last menstrual period, 3 months, plus 7 days equals the estimated date of delivery. For example, when the first day of the last menstrual period is October 20, 2020, you would subtract 3 months from October 20, 2020, and then you get July 20, 2020, and then add 7 days to July 20, 2020, and then get July 27, 2020, after which you would add 1 year to July 27, 2020 to get the estimated date of delivery for 7/27 of the following year, which is July 27, 2021. 5. You are working in a community pediatric health clinic. Which developmental task should you apply into your practice? You should apply the principles of initiative when caring for preschool children. You should apply the principles of sensorimotor thought when caring for preschool children. You should apply the principles of intimacy when caring for the adolescent. You should apply the principles of concrete operations when caring for the adolescent. 5. Answer A. You should apply the principles of initiative when caring for preschool children. The developmental task for preschool children is initiative, according to Erik Erikson. The other developmental tasks, according to Erik Erikson, are infant, trust; toddler, autonomy; school-age child, industry; adolescent, identity formation; young adult, intimacy; middle-aged adult, generativity; older adults, ego integrity. In the correct sequential order, Jean Piaget's levels of cognitive development include sensor-motor thought, infancy to about 2 years of age; pre-operational and symbolic functioning, from 2 to 7 years of age; concrete operations, 7 to 11 years of age; formal operations, 12 years of age. 7. You are working in a community pediatric health clinic. Which expected life transition should you apply into your practice for these pediatric clients as you are caring for pediatric clients of all ages? Pregnancy, puberty, childhood immunizations, separation anxiety. Answer B. The expected life transition should you apply into your practice for these pediatric clients as you are caring for pediatric clients of all ages is puberty. Throughout the lifespan, there are several significant expected life transitions that require the person to cope and adjust. Some of these expected life transitions include puberty, maternal and paternal attachments and bonding to the neonate, pregnancy, care of the newborn, parenting, and retirement. Although young children will experience separation anxiety and they will also be maintained on an immunization schedule, these are not expected life changes. 8. Registered nurses care for clients in many settings and environments. These clients can be individual clients, couples, families, populations, and communities. You have decided to use the Dimensions Modelof Health model to assess, monitor, and evaluate the health status of the community. Which of these dimensions is not an element of this Dimensions Modelof Health model? The biophysical dimension, the psychological and emotional dimension, the spiritual dimension, the health systems dimension. Answer C. The Dimensions Model of Health includes 6 dimensions that impact on the client, including the community. The spiritual dimension is not one of these 6 dimensions. These dimensions are the biophysical dimension, psychological and emotional dimension, health systems dimension, behavioral dimension, socio-cultural dimension, physical environment dimension. 9. You are the nurse in a multi-ethnic community health department clinic. In this role, you are asked to identify clients who have genetic risk factors related to ethnicity in order to screen them for some commonly occurring diseases and disorders. You would identify a client who is of Mediterranean ethnicity for cystic fibrosis, African ethnicity for Tay-Sachs disease, British Isles ethnicity for psychiatric mental health disorders, Saudi Arabian ethnicity for sickle cell anemia. Answer D. You would identify a client who is of Saudi Arabian ethnicity for sickle cell anemia. Other ethnicities at greatest risk for sickle cell anemia include those who are African, Latin Americans, Southern Europeans, and some clients from some Mediterranean nations. Other disorders and diseases and the ethnicities associated with them are thalassemia, clients with a Mediterranean ethnicity; Tay-Sachs disease, Ashkenazi Jewish people; cystic fibrosis, clients with a European ethnicity; psychiatric mental health disorders, African Americans and Native Americans. Hypertension, African Americans, Pacific Islanders, Native Americans, Alaskan Natives, Hispanic and Caribbean clients. Diabetes, African Americans, Caribbeans, Native Americans and clients from India, Pakistan and Bangladesh. Cancer, Caucasians and clients from Scotland and Ireland. 10. Which statement about targeted assessments is accurate? The need for a targeted assessment is based on the application of the nurse's knowledge of pathophysiology and the presenting symptoms. The need for a targeted assessment is based on the application of the nurse's knowledge of developmental needs and developmental delays. Targeted assessment is done on an annual basis for existing clients rather than a complete assessment that is done for new clients. Targeted assessments consist of a brief medical history, and a complete assessment consists of a complete health history and a complete physical assessment. Answer: A. The need for a targeted assessment is based on the application of the nurse's knowledge of pathophysiology and the presenting symptoms. Targeted assessments and screenings are done in addition to routine and recommended screenings when a particular disorder has a genetic pathophysiological component for risk and when a client is presenting with a particular sign or symptom. 11. You are fully aware of the fact that some risk factors are correctable or modifiable and other risk factors are innate and not modifiable. Which of the following risk factors is the most likely able to be correctable? Genetic predisposition. Lifestyle choices. High-risk behaviors. An external locus of control. Answer: B. Lifestyle choices are the risk factors that are most likely able to be corrected. Poor lifestyle choices place a person at risk and they are often considered also risky behaviors. Some risks are preventable and correctable and others are not. For example, genetics, age and gender are not modifiable risks, but the risks associated with lifestyle choices are modifiable, correctable and able to be eliminated when the person changes their behavior in reference to these risky behaviors. Some risky lifestyle choices include excessive sun exposure, the lack of regular exercise, a poor diet, cigarette smoking and the use of other tobacco products, alcohol use, illicit drug use, unprotected sex, avocational and hobby choices such as rock climbing, inadequate sleep and rest. Genetic predisposition is an innate and not correctable risk factor, and an external locus of control can lead to poor lifestyle choices. However, this is not the most likely correctable risk factor. 12. Your family, as the client, now has 4 children and the parents do not want any other children at this time. The mother has a history of deep vein thrombosis and cigarette smoking, and both parents have a history of the lack of adherence to medical regimens. Which form of contraception would you recommend for this couple? A transdermal contraceptive patch, a diaphragm, a vaginal contraceptive ring. None of the above. Answer: D. You would not recommend any of the above methods of contraception for this family. You would not recommend the use of a transdermal contraceptive patch or a vaginal contraceptive ring for the couple because both of these contraceptive methods are contraindicated when the woman has a history of deep vein thrombosis and cigarette smoking. And you would also not recommend a diaphragm because the compliance of this couple cannot trusted because the couple has a history of the lack of adherence to medical regimens. 13. A 87-year-old client has a history of heart disease and fibromyalgia. This client has an internal pacemaker and is also a diabetic client. During your annual visit with this client, the client tells you that they would like to begin some alternative and homeopathic healthcare practices. What should you include in your teaching plan for this client? Information about the lack of scientific evidence regarding the effectiveness of all herbs. Data to support the fact that magnets can be effective in terms of fibromyalgia pain, and as such, may be a good choice for this client. Research that suggests that prayer is an effective alternative method to relieve pain and stress that can be helpful to this client. Information that contraindicates the use of biofeedback because this alternative, complementary health practice can interfere with the client's pacemaker functioning. Answer, C. Scientific data now indicates that prayer is effective for the relief of stress, anxiety and pain, and as such, may be helpful to this client. Some herbs, minerals and supplements are scientifically deemed as safe and effective and others are not scientifically effective and they can also lead to harm. At the current time, the National Institutes of Health, NIH, states that magnets are not scientifically effective and they are also not considered safe for clients with a pacemaker or insulin pump because these internally implanted devices can be adversely affected by the magnetic force of the magnet, and, lastly, biofeedback does not interfere with the client's pacemaker functioning. 14. You assess your family as having a deficit in terms of their instrumental activities of daily living, ADLs. Which healthcare professional would you most likely refer this family to in order to address this deficit? A social worker, a physical therapist, an occupational therapist, a speech therapist. Answer, A. The healthcare professional would you most likely refer this family to in order to address this deficit in terms of their instrumental activities of daily living, ADLs, is a social worker. The activities of daily living are differentiated in terms of the basic activities of daily living and the instrumental activities of daily living. Examples of basic activities of daily living include things like bathing, mobility, ambulation, toileting, personal care and hygiene, grooming, dressing, and eating. Deficits in terms of the basic activities of daily living are best addressed by a physical and/or occupational therapist. 16. The sense of hearing is assessed using which standardized test? The Taylor test, the Rina test, the Babinski test, the Apgar test. Answer, B. The sense of hearing is assessed using the Rina test and the Weber test and a tuning fork. 17. Which of the following steps is the final step that is used during the physical assessment of the abdomen? Inspection, light palpation, deep palpation, percussion. Answer, C. Deep palpation is cautiously done after light palpation when necessary because the client's responses to deep palpation may include their tightening of the abdominal muscles, for example, which will make the light palpation less effective for this assessment, particularly if an area of pain or tenderness has been palpated. Inspection is typically the first step and percussion of the abdomen should be done prior to any palpation, particularly deep palpation. 18. Which sound should you expect to hear when you percuss the liver during a complete physical assessment? Resonance, flatness, tympany, dullness. Answer, D. The 5 types of sounds that are elicited during percussion are flatness, resonance, hyperresonance, tympany and dullness. Dullness is heard when percussion is done over a solid organ like the liver and spleen. Flatness is normally assessed over muscles and bones, resonance is a hollow sound that is heard, for example, over the air-filled lungs, and hyperresonance, which is a booming sound that is heard over abnormal lung tissue, as occurs among clients with chronic obstructive pulmonary disease, COPD, and, lastly, tympany is heard over the stomach with air as a drum-like sound. 19. A comprehensive health assessment includes a complete medical history, a general survey and a complete physical assessment. A complete medical history, a general survey and a focused physical assessment. A client interview, a significant other interview, a general survey and a complete physical assessment. A client interview, a significant other interview, a general survey and a focused physical assessment. Answer, A. A comprehensive health assessment includes a complete medical history, a general survey and a complete physical assessment. Although a complete medical history is done using a client interview and a significant other interview for much data, it is the health history and not the interview that is part of the comprehensive health assessment. A focused assessment is done as based on some pathology, sign or symptom and it is not considered a part of a comprehensive health assessment. 20. Select the sound that is heard with percussion with its description. Tympany, a hollow sound. Dullness, a thud-like sound. Dullness, a hollow sound. Resonance, a booming sound. Answer, B. Dullness is a thud-like sound and not a hollow sound. Timpani is a drum-like sound, and resonance is a hollow sound.